Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine. In just around 15 minutes, we'll bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are honored to be joined by leaders of American College of Lifestyle Medicine's Cardiology Member Interest Group. Dr. Svetlana Chamoun is a double board certified cardiologist, founder and president of Cardiology, and host of the influential Cardiology podcast. A diplomat of the American College of Lifestyle Medicine and a certified health and wellness coach, she is also the author of 2 empowering self-help books aimed at supporting women physicians facing burnout. Through her Reclaim Wellness programs, public and professional speaking engagements, educational content, and writing, Dr. Chamoun is a leading voice in advancing the principles and practice of lifestyle medicine. Dr. Andrew Freeman is a board-certified cardiologist committed to the prevention and treatment of heart disease through a balanced integration of conventional cardiology and holistic wellness practices. He utilizes advanced diagnostic tools alongside lifestyle-based strategies, including whole food, plant-based diet, regular physical activity, mindfulness, and emotional support. Dr. Freeman is known for his patient-centered approach that emphasizes sustainable health and long-term disease prevention. Welcome. How are you guys doing today?
Great. Thank you so much.
Yeah, thanks for having us.
Thank you for joining us. So first of all, as we start our conversation, I always like to ask my guest, can you please share your personal journey into the field of lifestyle medicine and what inspired your commitment to this approach to care?
Should I start?
Yeah, please.
Well, thank you so much for inviting us to join you on this podcast today. I'm Dr. Svetlana Chamoun. I am the co-chair of the Cardiology MIG and CEO of Cardiology. And Padmaja, my journey into lifestyle medicine started way before I even knew what those 6 pillars of lifestyle medicine were. So years ago, when I was practicing conventional cardiology as a regular cardiologist, I kept having that nagging feeling that something was missing. Something was amiss. And even though we were doing everything right, ordering the tests, prescribing the medications and performing the procedures, something was amiss. It felt like we are addressing only a part of the problem. So I did not have the words for it back then, but now I realize that I was searching for something more holistic, the approach in cardiology, more holistic, that saw patients as a whole, not just recipients of treatments or a disease process, right? And over time, I discovered ACLM. I got board certified as a lifestyle medicine physician and got increasingly drawn to prevention done right.
Yeah.
I just could not ignore, how we see people when they already develop disease and the cardiovascular system is irreversibly damaged. And my really awakening happened during COVID. When everything shifted. It was a complete mindset shift for me. The system just imploded. You all know and experience that. And it was very heartbreaking to me as a cardiologist to see so many people die and get disabled, people who may have had a chance to survive, had we focused on the root causes of their cardiovascular problems and resilience from the start. Right. And also, the same time, I watched my colleagues fall apart, essentially. They were burned out, they're overwhelmed, carrying way too much weight on their shoulders, right? And it hit me hard. Burnout and chronic stress don't just impact how we care for others. They also quietly damage our own hearts, our own cardiovascular system. So finally in 2022, I launched Cardio Seeds. It's our unique cardiology practice where we practice what I call behavioral cardiology, not no medication titration, no procedures. There's just multi-level evidence-based solutions based on the 6 pillars of lifestyle medicine, behavioral changes, coaching, and creativity to channel those harmful behaviors into new light, reduce stress and burnout, improve heart health, and support our physicians in their overall well-being, ultimately cultivating the healthier, more resilient healthcare workforce.
Wow, powerful. Thank you for sharing that. Andrew, what would you add?
Well, so I grew up on the East Coast in New York, and it was very interesting. As I was growing up, many of my friends' parents were dropping dead or having bypass surgery or colon cancer or breast cancer. And it took me a long time to realize that it was really the way we were living, right? It was the very rich foods that we ate, the 7 inches of pastrami or the 3 inches of cream cheese or a piece of pizza weighed 5 pounds. And it took a while and, went through training and, nutrition wasn't really discussed. Lifestyle wasn't really discussed. It wasn't anything we were trained on, even in cardiology. And then I trained in North Philadelphia at Temple where, everything that surrounded us was greasy and fried and bad and so forth, a real food desert. And then I finally came out to Colorado where I practice still to this day and, really started not only doing a program like Walk with a Doc, which we've been doing for about 15 years. So I started that literally right after I came out of fellowship. And then, sort of have gone through unbelievable amounts of nutritional lifestyle exposure and so forth. And then at the American College of Cardiology, was surprised to learn that there was no home for somebody like me. So we started the nutrition and lifestyle work group at the ACC, which has been incredibly productive and has lots of people part of it, like Ornish and Esselstyn and Barnard and others. I always tell people that I got to write the letter that supported Dr. Barnard's FACC that he got from the American College of Cardiology. But it's been a lovely tour through all of the different sort of, professional societies to see how little this was part of mainstream medicine. And now, 15 plus years later, seeing how much we've taken a bite out of mainstream medicine, no pun intended, really eye-opening. So for me, it's been amazing. And then my own institution, when I started doing this, I was swimming upstream. The chair of medicine, would call me out in the middle of a meeting and say, well, if Dr. Freeman approves of this menu or whatever, like in a sort of jokingly way, and now here we are, and this is a main part of what we've done, including things like the Ornish Intensive Cardiac Rehab that we ran for a good number of years, and the Walk with a Doc program, and of course all of our initiatives. We actually just did one of the very first cardiac prevention meetings in the Denver area. Dr. Frades was actually out here, as you may or may not know, and it was lovely. So bottom line is lots of things that we've done over the years that have been exciting to watch and grow lifestyle approaches to medicine. And, I can't really wait this can't really wait anymore in mainstream medicine. We really can't continue to spend all the money we spend on medications and procedures without really going after the root cause. So,
yes. And it's always exciting to talk to specialists and their passion for addressing the root causes. And all of us in primary care, we're somewhat trained and sort of, geared towards that, but it's always encouraging to have it come from cardiologists, right? So thank you for sharing that. So Svetlana, let me ask you, since you talk about the physician burnout, what is the relationship between physician burnout and cardiovascular disease? And why should this intersection be recognized as a critical concern within cardiology?
Mm-hmm. Padmaja, thank you so much for this question. It's such a great question, and I'm really passionate about raising awareness on this. So think about it. Burnout, chronic unresolved stress and burnout is often brushed off as something as emotional exhaustion, right? Mental health concerns. However, it's much deeper than that. What many people do not realize, even in our profession, that chronic stress is a real major cardiovascular risk factor, and often is a common root cause for other cardiovascular risk factors, such as high blood pressure or hyperlipidemia, high cholesterol, etc. So as far as I'm concerned, that makes absolutely a cardiology issue. So one of the most eye-opening studies that I like to briefly share with you comes from Dr. Osborne and his team. It was published in Circulation, Cardiovascular Imaging. So what they found was fascinating and honestly very alarming. Chronic stress kicks our body into overdrive, activating our HPA, the hypothalamic pituitary adrenal axis, raising cortisol and adrenaline. That over time leads to high blood pressure, systemic inflammation, insulin resistance, triggers unhealthy habits. And all of that adds up over years, increasing the risk of heart disease, increasing the risk of arrhythmias, stroke, high blood pressure, and other serious conditions, right? So it's just not, this is not a theory. This is actually what's happening on imaging studies. We can actually see it and watch the biology of burnout unfold in real times in our imaging studies as cardiologists. So when we talk about stress and burnout in medicine, we as physicians, not just talking about feeling tired or overwhelmed. We're talking about the process, pathophysiological process that is physically harming our hearts and our blood vessels. So, and what's especially concerning is how common this is among physicians, right? So more than half by the self-reporting through the various questionnaires of physicians in this country experience burnout. So we are trained to keep going, to push through, put the patients first, and that iron dock culture, the long shifts, the pressure, the lack of downtime, the lack of empathy to self and one another, puts us at the real risk of developing serious cardiovascular complications as providers, becoming our own patients in a way. So, and many of us don't realize that until we're already in trouble, right? So, the more we understand the science behind it, the better we are equipped to change the system and to protect both our patients and our own healthcare workers in the United States and we already have the tools to address these chronic diseases. We already have the tools to address the root of chronic disease. We have to implement those things in everyday practice. So this is a conversation we have to keep having all the time, not just for ourselves, but for our colleagues, our patients, and the future of medicine.
Yes. Well, thank you. That's very informative. I don't think we connect the dots here in terms of burnout with the cardiovascular implications. So thank you for sharing that. Andrew, can you please highlight how is lifestyle medicine transforming the culture of cardiac care by shifting the focus from intervention to prevention?
Well, I think a lot of this actually all comes down to the money that's being spent, right? So the payers are noticing that they are spending more than ever, particularly in the last several years of life. The payers are noticing that people are not doing as well. Heart disease still remains number one as an example. And we are finding that there is, especially in some of the integrated delivery networks and other care type of accountable care organizations, that people are doing more cost-effective care when they incorporate lifestyle medicine into everyday practice. So at the end of the day, I think people are realizing that literally, an ounce of prevention, right, is worth a pound of cure. And this translates into real dollars. One of the issues that I think probably doesn't get enough attention is that many of the insurers are not willing to spend on prevention because they see it as a potential loss. And the reason that is that they see that if they spend money now, they may not see a result for 2 to 3 years. And so they were like, well, we'll probably lose that person. There's turnover. But of course, as they lose some of these people where the prevention's been implemented, other people come in. And so it certainly makes sense, at least in my opinion, that we hit this prevention and understand that the downstream cost savings works for everybody, really. And then, of course, Medicare, by the time I'm ready to access it, and some of you may be closer than me, but may be bankrupt, right? And so,
Yes.
We may not even have the ability to utilize all these things we've paid into for all these years because it's so oversubscribed and overutilized. And at the end of the day, I think that weighs heavily on many of our hearts. We all went into medicine to try to help people, and yet we keep throwing devices and medications at people, and they're not necessarily getting all that much better. So for me, getting people to be aware of this is the big plus. I think getting people to understand how when we apply lifestyle medicine to everyday practice, people get better. I work at a very specialized hospital. It's a quaternary referral center for all sorts of rare diseases, pulmonary hypertension and sarcoidosis and things we all learned about in medical school that many of us have probably not seen. And my colleagues are always surprised, particularly in some of the pulmonary areas, how much better people get when they apply lifestyle medicine. And of course, we're throwing things like steroids at them and, monoclonal antibodies and anti-inflammatory drugs that are in the chemotherapy realm. And when people put themselves in this anti-inflammatory healing environment, rare diseases respond. And people are always surprised by this. And I'm not, of course. So I think it's there. And then on top of that, I think when you have someone who's lifestyle minded and you are doing lifestyle medicine in everyday practice and you're doing things like Ornish lifestyle medicine and some of the other things we've done over the years, people see these results. And I would tell you, when I was really just swimming upstream by myself, it felt very isolating. And now we probably have, 10 to 12, maybe more doctors who are fully plant-based. Whether they do this with their patients or not is a different story. But the results are remarkable and they speak for themselves. And now every professional society embraces this plan and this approach. And so it feels much more mainstream than ever before. So I think we're getting there. It's just a very, very slow glacial pace that I think needs to be accelerated.
Yeah. And I think you said it very well that there needs to be aligned incentives, right? Once we get paid for delivering better outcomes, I think everyone will want to jump on this. So for sure. Svetlana, can you share a little bit about what practical steps can cardiology professionals, your colleagues can take into if they want to integrate lifestyle medicine into their clinical practice?
This is one of the multi-million or multi-billion-dollar questions, right, in the United States. However, I think we have some answers to this. Interestingly, when I talk about lifestyle medicine at grand rounds or other presentations or conferences, people come to me and ask, how do we persuade our administration, to start practicing lifestyle medicine, to introduce real physician wellness programs? I always start sharing how I personally made the shift when I realized that cardiology is so much more than just pills and procedures. So it took me pursuing lifestyle medicine board certification to truly master the evidence-based tools and fill a big gap, training gap in my educational gap in our field. So that education and knowledge is the first step, what I think. And then what I suggest to others is to start by getting educated, board certified, and possibly educate people around you, including your colleagues, around your trainees, educate your administrators. I emphasize also patient engagement. One can create simple, practical wellness toolkits for lifestyle, the pillars of lifestyle medicine, like meal plans, exercise guides, stress management workshops, right, for patients. And that provides patients with simple and effective instructions and behavioral modifications, 6 pillars of lifestyle medicine, etc. So one can make it as a part of every single cardiology visit. And I realize, it's not possible or very hard to do within the time constraints of that 15-minute per patient time constraint, and advocate that physicians really seek administrative support and team approach to achieve the broad implementation of lifestyle medicine resources at their hospitals. But on a bigger scale, I urge colleagues to become advocates and become leaders in this space, pushing prevention-focused care and working to secure resources such as, coverage, the CMS coverage for programs like Dr. Ornish that Andy already mentioned, partnering with Blue Zones, joining the ACLM Health System Council. So we may need to change the system, right? Must change the system, not just individual care. And one thing that I always say to many people, model healthy behaviors, that you preach, right? Provider well-being and practice in lifestyle medicine, both reduce burnout, as per Dr. Lianov's paper, reduce burnout and improve patient outcomes. So we cannot miss on that. We need to do something that resonates with both patients and healthcare professionals. And so my advice is simple: join ACLM, get board certified, find like-minded colleagues and administrators, start and expand lifestyle medicine program at your institution, and mentor trainees to carry this forward. And use every single platform you have, including public talks and the community events, if you have a chance to be on podcasts like this one, to share this message with as many people, as many healthcare professionals and patients as you can.
Yes, I love that passion. Andrew, would you like to add anything to this? Do you have anything to add when it comes to advising your colleagues in terms of how to start a lifestyle medicine integration into their clinical practice?
Yeah, I mean, first, I think it all starts with personal behaviors, right? So there's a lot to be said, and all of us learn through modeling, right? We watched our attendings, our mentors, our teachers throughout the years and what they do. And I think, it's easy to say to somebody, hey, don't eat any more cheesesteaks. You just had bypass surgery. And then we all went and have cheesesteaks for lunch like we used to do when we were in training. It's another to say, hey, you shouldn't eat these anymore, and we don't either. And really just focus inward and really get to that place where I think you're comfortable, practicing what you preach. And then, from there, I think understanding how to appeal to a hospital or an organization or institution's mission statement. The truth is that lifestyle medicine actually applies to every single mission statement I have ever seen, ever, anywhere. So if you look at your institution, it probably says something like, we wish to advance the care of medicine in our community and keep costs down, or whatever it says. And the truth is, that's exactly what lifestyle medicine does. So if you bring this to administrators and say, I do this, there's data that supports this, the professional societies support this, it will bring in dollars and people that are seeking this type of alternative and complementary approach to everyday and mainstream medicine. It's a win for patients. It's a win for us. It's a win for our personal practice and our personal satisfaction, which also helps to avoid burnout, which is a major issue these days. And I think when people start to see that all these things align, it's really hard to say no. And so I think when you can speak that hospital administrator language and show that there's an upside, a profit, and you're also doing good for patients in the community, it's really hard to say no. And people find it very hard to say no to me when I say these things. So we've actually been able to do a number of these things over the years. And I sure hope that other people will take a look. And if you're interested, you'll see some papers from my colleagues who you probably know well, Dr. Monica Agarwal, Rob Ostfeld, and myself. We've written a number of papers about how to do this type of work. And it's really eye-opening and easy to do, surprisingly, once you get your mission and focus aligned. So.
Great tips. Thank you. It's been absolutely a pleasure to speaking with both of you. While we're out of time, I want to thank both of you for your valuable insights and for generously sharing your knowledge and expertise. Thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.